Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the pathology of ulcers? So first we will see the pathology of gastric ulcer. So gastric ulcer pathophysiology. Right. In the pathophysiology of gastric ulcer, first and foremost, there is increased serum levels of pepsinogen 2 will be seen. There is also increased gastroduodenal reflex will be seen. There is increased pepsinogen production will be seen. There is increased duodenogastric reflex is seen, and there is decreased parietal cell mass and decreased maximal acid output are the important features in gastric ulcer.
thank you and thank you for watching.